Let's wrap that up with this final topic of let's assume the presidential election and what this will mean. So in the debates I've seen Mitt Romney discuss, he wants to deliver Medicaid in different ways. Can you discuss what does he mean by that?
Yeah, so the proposal that Governor Romney's put out there has focused on this idea of block granting, where instead of having a match rate where essentially states can, above the minimum thresholds, decide how much they want to spend, know that 50 to 80% is going to get covered by the federal government, that instead they're going to basically get a lump sum each year and from the federal government, and states then can decide how they want to spend it with a whole lot more flexibility in terms of who's covered, covered benefits, and provider reimbursement, and a whole host of issues. So I think there are two pieces of this that we really need to separate out.
Who's opposed to that and why?
Well, so this is what I was going to say. That you can agree that the incentives for states to be efficient with their healthcare dollars and Medicaid to stop playing games in terms of the match rate is clearly enhanced by a shift to a block grant. But you have to couple that closely with, well, what's the dollar amount? And so the less discussed part of this is that, at least in the Ryan budget plan, which is probably the closest template we have as to what level of spending we're talking about with the block grant, Medicaid spending is going to be pegged to general inflation and not healthcare spending, which means that we're talking a shrinking portion of dollars going into people in Medicaid. So any, I think, credible estimate on how much states might be able to wring out in terms of efficiencies is probably not going to be enough to cover the number of people who are currently covered. So the estimate, one estimate from the Urban Institute, which is a liberal-leaning think tank, was that the Romney plan would actually lead to 72 million Americans without health insurance in 10 years, because not only repealing Obamacare, but the baseline coverage of Medicaid that we see right now would erode significantly. There simply wouldn't be enough dollars going to states, and as you said at the outset, states can't print money. If recession hits, or even before a recession hits, if that rate of increase doesn't keep up with healthcare costs, you can try to be more efficient in that, and we want that incentive, but it's almost certainly not going to be the case that they can continue to cover the number of people that Medicaid currently covers.
Yeah, no, I agree with that. I think, there was a piece in the Washington Post today or yesterday basically said this is a healthcare election. This actually is a healthcare election. This is probably the most important issue in the election. Most people, I think, in the American public probably don't understand exchange and Obamacare. But I think it's this is really central, and I think there's a real A/B sort of what could happen.
Let me just point this out: the spending on healthcare is greater than the military. So go ahead.
And
ahead.
it's going to grow faster. And I think, look, this is a healthcare election. It's also a deficit election. And my problem, I'm happy to pay more taxes. We're collecting 15% of GDP in revenue. We probably should collect 19 or 20. But we're also spending 25% before you do President Obama's expansions. When President Clinton left office, it was 18.9% of GDP was federal spending. It's now 25%. You're locking in 25% of GDP forever. So the concern that people have about this is, morally, is it a nice thing to talk about universal coverage? Yes, but not when you don't have your house in order. And so I think when you look at these spending issues, it's a deficit election and a healthcare election, and they're inseparably entwined.
Right.
Nobody doesn't want to cover all these people. The issue is, how are you going to pay for it and how are you going to do it?
Yeah, well, we used to joke that General Motors happened to be a large health insurer with a big pension obligation, that they just happen to make some cars. I think the federal government is a large Army and Navy and a health insurer. That's sort of, if you add those two up, that's a majority of our spending.
Getting back to Medicaid, people say, well, Mitt Romney's the Democratic government is going to cut Medicaid, and he's going to cut what it would otherwise be over the next 10 years by saying simply, I'm going to give you a state. If you're a state that's spending $30 billion today, $10 billion is federal and $20 billion state, or $20 billion is federal, $10 billion state. We're going to give you what you got today, an index to inflation, and see you later. Now, relative to what would happen otherwise, that's a, quote, cut. And I think it has to be modified a little bit, as I said. But the fundamental concept is Medicaid's growing way out of control, and can we afford it without we're not even collecting the revenue now?
We have 4 minutes left. Medicaid's growing out of control. Do you think any of these plans are something we should be optimistic about? Do you think we'll finally get a grasp around this with Massachusetts doing major things?
Well, I want to dispute the notion that Medicaid's growing out of control, in the sense that it's in economics. You pay for things and you get a benefit, and you're going to say we're not paying for it, and I get that. The question is, there's clearly a benefit of covering people. There's the moral argument. There's a public health argument. There's, in theory, some long-term economic arguments for having a healthier population, and there's clearly a cost to pay, and that cost is going up significantly. But as one economist, David Cutler, has written about, we can spend more money increasingly on healthcare, and that doesn't mean it's out of control. We have to decide if we like what we're getting for it, and we can have a reasonable argument about whether these expansions of expanding $100 billion in Medicaid spending at the federal level on covering 16 million more people and potential health benefits and survival benefit, whether that's worth it. And it may be that the answer is no. Maybe that it's a partial answer, depends on the population you're talking about. But that we ought to be having that same conversation about every aspect of what that $1.2 trillion deficit is. And right now we're not.
I agree.
We're not having much of anything, and that it would behoove us obviously to be making better decisions in a whole range of areas. And I fear that right now that there's a tendency in this current campaign to think that repealing Obamacare fixes the deficit somehow, and that's
a big piece of it.
I think structural healthcare spending is the big piece. That if we got rid of the Medicaid expansion, Medicare cost growth is still the single biggest healthcare driver for the federal government.
But you
Give you a last comment. What do you have?
Yeah, well, look, I'm generally wired as an optimist because I'm an investor, and you have to be an optimist to be an investor generally. I'm actually reasonably optimistic that the magnitude of the fiscal cliff that we face, the magnitude of the cost issues in healthcare, particularly Medicaid and Medicare, are approaching a point that they will crowd out everything else in the federal budget. And I tend to also think that as a country, we tend to act when things get to this point of an emergency. I don't know if we're there today. I certainly know in 5 to 10 years we will be. So whatever things that are happening now, I think in 5 to 10 years we're going to ultimately have a better healthcare system, and better Medicaid is going to be part of that.
I think the emergency is happening at the state level through Medicaid, and if we see a global healthcare reform, it's going to come from under the radar through Medicaid.
I think that's right. I think the main thing is we don't act on emergencies, and we ought to encourage the few guys that are in the middle to talk to each other. The Mark Warners is a moderate Democrat from Virginia, the Bob Corkers from Tennessee. We'd encourage those guys who actually do talk to each other to try to get something done. And the Bowles Simpson thing, I mean, we have problems, the budget deficit are largely based around health care. And I'd like to cover all these people too, but you got to do it in a rational way, and you got to do it at a reasonable pace.
But I guess my question for you is: would you agree that healthcare as the driver, one of the big drivers of the deficit? We're not really talking about Medicaid for poor adults, right? We're talking about the disabled and long-term care. And we're talking about Medicare, right? Which is the sacred cow that in this election you can't go anywhere near. So,
all of them should be.
Yeah, they should all be on the table.
So up to me, I'd pass the Ron Wyden plan tomorrow.
Right.
Yeah.
Politically can't do it, but it's the right thing to do.
All right. Well, that's exactly 1 hour. So thank you very much. Very interesting. Thank you.